Come 13th midnight, across the country, in all the facilities, there is no healthcare worker who is going to be there. Kenyans will not be able to access the services because simply the government has decided to go on strike. Afya power.
Power.
Solidarity.
Forever.
My fellow unionists and the members of the 4 states. My name is Wachira Peterson. I am the National Chair for Kenya Union of Clinical Officers. I am also the Chair for Health Union Caucus that brings together the unions that represent health workers, together with also the Kenya Health Professional Society that represents those who are not unionized. We must be able to strategize as a nation on where we want to go to. I think our president, under the plan, had provided very well that we did the universal health coverage, which simply means health is brought nearer to where you are. And he now said that I want to move from universal health coverage to universal health care, which means now we don't just want to know that health services are near you, we also want to know the quality of those services that are near you. There is no way you are going to get these quality services if you are not going to have people who are going to stay at work for many years, gain experience and specialize so that they can be able to be better in their trade. And that is what is now happening. So let me say that it's very unfortunate what is happening here. And I can say without doubt that these workers have been subjected to unfair termination in the context of Employment Act, the Labor Relation, and even the Public Service Commission Act, and that even the contracts that are being given are irregular. And as the unions, we are going to take all the necessary measures to ensure that our members enjoy their rights, and we are not going to spare anything. Let me say that we have an outstanding nationwide strike that is going to begin on the midnight of 13th of this month. We had given the counties and the Ministry of Health 60 days from 15th of May so that they can come to the table and we can agree on the matters of the collective bargaining agreement, including the contracts that we are talking about. For all that time, we have not seen any engagement. They have not even responded to our letters. So I want to tell Kenyans that it's unfortunate. We as the unions, we had the goodwill. We gave the 60 days so that we could go on the table and we couldn't interrupt the services. But the government seems not to care about the citizens. They don't care whether you are going to get the service or not. And they have decided we can go on strike, and I can assure them we know how to do it. And come 13th midnight, across the country, in all the facilities, there is no healthcare worker who is going to be there unless some magic happens and within the 7 days, we complete the CBS that we have and register. Kenyans will not be able to access the services because simply the government has decided to go on strike.